When you hear this sound, it often means someone needs blood. My name is Takumi INOUE. Through this video, I would like to think about transfusion. Title is How Can We Solve the Blood Shortage? Search for ways of blood transfusion. Now let's start. If you lose a lot of blood through a major wound, if you take a constant amount of time to undergo major surgery, if you suffer from severe anemia due to illness, you will need to be treated with blood transfusion. If you continue to run out of blood for a long time, you may become fatal to your life. Blood transfusion is one of the most important treatments to survive a fatal situation. Therefore, this treatment is currently the most frequent organ transplantation. Who is collecting blood? All the blood is collected by the Red Cross. Their activities are to recruit the necessary blood to passers-by. They tell passers-by many people need blood transfusion and demand blood to cooperate in providing blood. Donors who decide to provide blood receive an examination and blood is drained by injection. The collected blood is properly examined by the Red Cross and is brought to the recipient waiting for blood transfusion at the hospital. Therefore, blood transfusion is supported by well-intentioned volunteers blood donors. Who will receive a blood transfusion? Please take a look at this pie chart. Most recipients using blood transfusion are over 50 years. The reason is blood is used for cancer and cardiovascular surgery or treatment of anemia. These diseases are more common among older people. Recently, the number of older people has been increasing due to aging population. Therefore, it is required a lot of blood. Despite this situation, the number of blood donors has declined year by year. Particularly, it is decreasing young generation of blood donors, teenagers, 20s, 30s. As blood donors continue to decrease, it may become a large-scale shortage of blood in the future. It is essential to think about how to secure the blood used for blood transfusion. Then, you also need to know about the risk of blood transfusion. First of all, our blood contains some of the virus. Like volunteer blood, there is still a risk of infectious diseases, such as hepatitis and AIDS. These viruses cause you some life-threatening illnesses. The Red Cross inspects the blood collected from the donor. Recently, it has become possible to detect viruses contained in most blood by introducing highly accurate inspection equipment, but the risk of infections caused by blood transfusion have not completely disappeared yet. Several people who receive blood transfusion are infected with viruses every year. It is difficult to accurately find the polluted blood. Another problem is that there are various types of blood. We know that blood has ABO type and RH type. When you receive blood transfusion, you need to have the same blood type injected. If you do not, immune-related reactions occur. This is called a transfusion reaction. Most transfusion reactions occur because of errors made in matching the recipient's blood to the blood transfused. When transfused reactions occur, various symptoms appear in the body such as fever, chills, pain at the transfusion site, vomiting, and dyspnea. In the worst case, it may lead to death. We are afraid side effects are caused by blood transfusion. How can we prepare blood without side effects? Imagine it. First, autologous blood transfusion is a safe way. Autologous blood transfusion is a method using own blood. If you use your own blood, there is no risk that other people's infections will be transmitted through the blood. Also, there is no risk of blood type mismatch. But autologous blood transfusion has some disadvantages. First is a limit to the amount of blood that can be collected from patients. If patients need a large volume of blood transfusions, the patients cannot supplement the blood with autologous blood transfusion alone. Second is if sudden transfusion is necessary. Autologous blood cannot be secured. Autologous blood transfusion requires blood to be collected in advance before surgery. Third is autologous blood transfusion is available for only patients who do not have health problems even if blood is collected. Therefore, autologous blood transfusion cannot be used for patients who are in bad physical condition or who are short on physical strength. But if more patients use autologous blood, the amount of blood, which depends on donors, will also be less. Then, scientists are trying to create artificial blood. In the latest research, scientists are trying to develop artificial red blood cells in some ways. One of them has modified hemoglobin. Hemoglobin is contained in red blood cells and binds with oxygen. In other words, it has a role of transporting oxygen into the body. Scientists artificially process hemoglobin and make artificial red blood cells. The second method is to artificially produce large amounts of real red blood cells using stem cells. Stem cells can differentiate into any cell such as nerve cells, muscle cells, skin cells, liver cells. Therefore, stem cells can differentiate into red blood cells. These artificial bloods are not yet completed in the middle of development, but it is approaching completion little by little. Development of artificial blood is highly expected because artificial blood has many advantages. For example, artificial blood can be prepared as much as patients need when needed, and artificial blood has longer storage periods than donor blood. The storage period of blood is very short, only 1 or 2 weeks, and the volume of blood collected is also dependent on volunteers. Therefore, it may become blood storage depending on the timing. If artificial blood has been developed, stable blood supply will become possible. In conclusion, we have a serious problem on blood transfusion. In near future, the amount of blood transfusion may become insufficient. It is necessary to solve this problem. It is our role to think about this strategy. The following 3 factors are important to solve this problem, I think. These are safe, accessible, sustainable. This problem will be solved when safe, accessible, sustainable blood is detected. When you hear this sound, please remember someone needs blood for blood transfusion.